Case of constrictive pericarditis. Contents of this video: history and physical examination findings, chest X-ray view of calcification, echo views and findings, CMR findings, cardiac cath findings, treatment and follow-up. History. A 48-year-old male fisherman presented to OPD with complaints of exertional shortness of breath, orthopnea, and swelling of the lower limbs, which were gradually increasing for the last 4 months. Denies any post-surgical and medical history except pulmonary tuberculosis 3 years back, for which he was treated at that time with ATT for 6 months. On examination, blood pressure 170, pulse 102 regular, S1 plus S2 plus 0, pedal edema plus 1, fine basal crackles bilaterally and slightly raised JVP. These findings were present at the baseline investigations were done, which were normal except for low hemoglobin, a raised total leukocyte count, and a raised level of LDH and ESR. Now let's see the chest X-ray lateral view, which shows a calcified rim. That is a lateral view you can see marked by the arrow. A thick calcified rim can be seen clearly. Now see the patient's echo. The first is the parasternal lung axis view. You can see a thick calcified rim of pericardium. You can see the interventricular septal motion. This is called septal bounce, clearly seen. Now let's see the short axis view. In this view, you can see 2 points which are supporting constrictive pericarditis. The D-shaped LV, which is visible. Now you can see that. And the other is septal bounce. You can see that the interventricular septum is bounding in between the two ventricles during diastole with the change in the pressure. You can see clearly. Now see the 4-chamber view. In the 4-chamber view, you can clearly see the ventricular interdependence, which is the abnormal movement of interventricular septum during diastole, which changes with inspiration and expiration. This is called ventricular interdependence. The thick, shining, and calcified pericardium can also be seen very clearly around the heart. So the patient's CMR was planned and was done. You can see now. You can see the different findings. There is a thick pericardium around the heart. The patient cardiac cath was then done. You can see that the expiration and inspiration phases, and you can see the change in the pressure clearly. This patient was stabilized initially and was then referred to cardiac surgeon for pericardiectomy. A successful pericardiectomy was done and the patient was then discharged after 7 days. On follow-up, the patient's clinical status was drastically improved. Thank you for seeing. Please like and subscribe.